First of all, I would like to thank all of you to find the time to come and listen to today's presentation. So this presentation will run through for 3 days. These 3 days, today, 24th and 26th, it will be 3 different separate sessions. So today what I'll be going through is basically the introductions of special needs and ASD, focusing on ASD, which is Autism Spectrum Disorder. And on the Wednesday, we'll be talking about ADHD and dyslexia. And on the final day itself, which is on Friday, I'll be talking more about the support and resources that special needs children could get, and also it will be an open discussion, a lot of more interaction in terms of the engaging how the participants would like to ask more, would like to know more. I think it'll be good to have an open conversation there. So these 3 days is basically a continuous sessions, how it will lead through to what the topic that I want to bring awareness of. I would like to thank Maplebear again, Miss Lydia, to give me this opportunity to share what I feel that it is important to know in our society right now. So again, it's named as Story Conference because I want to bring my experience with my son Julius. So and how I managed through these couple of years, and how he managed to learn and overcome his fears, him being different from his peers. So without further ado, I'll go into that. So about Julius, he was enrolled with Maplebear Phillip Avenue when about a couple of years back. So now he's no longer there, but his heart is always there, and Miss Lydia and the rest of the teachers who taught him will always have this special place of Julius in their heart. It plays a major role, these educators and to Julius, because that's how he managed to grow as well. So what happened was that about 19-month-old, we have enrolled him to the childcare. That was back when me and my husband were still in Malaysia. So we enrolled him into a childcare in Malaysia. We didn't intend to stay in Singapore. I'm not Singaporean, so even though I'm a PR here, so we decided to have his pre-primary education back in Malaysia. We had it all planned out. Let's send him to international school where the curriculum it's more relevant in terms of when he comes to Singapore, he can catch up a little faster. We had all this planned out like how parents always do. And when he was in 90 months, we decided, okay, let's send him to childcare. It was not a very normal or a usual thing to do in Malaysia, because mostly they will only send their kids like 3 years old and above. But now I think the trend is coming in. So me just following, I grew up in Singapore. I had a Singapore education ever since kindergarten, since I was 5 years old, all through my university, and I'm here. So I'm just following this footstep of how Singapore education is supposed to be. So I was like, let's put him into childcare and expose him to this early learning and stuff. Alright, so about a couple of months in the childcare, one day the teacher just told us that you might want to bring Julius to see a specialist, or see a doctor, or somebody that we can heed a medical advice. I was like, why? And then she started to say that Julius is very different from the rest of the kids. He loves to jump around, run around in class, climbing the tables. This might sound very normal because he's a kid, but problem is that the peers in his classroom is basically about his age as well. So it is not very normal for him being the only one who were jumping around, running around when class is going on. So he's not able to focus, he's not able to sit down like how his peers is. So the teachers was telling us that this is not the first time that she sees such child. So it might be good to sort of like seek for professional advice and see how he can be diagnosed. He at that point of time she didn't really mention about what kind of disorder that she's suspecting, but she just feel that he is different. So and I would really like to also thank that specific teacher because of her early detection, that she feels something is different, and then we start as a parent, we start to question whether it's true or not. So I immediately book an appointment with a polyclinic in Singapore because with such a disorder, or for example kids that are indifferent, I am not very familiar with the Malaysia system and how the medical system is moving on and stuff like that. So I didn't really want to take the chance. I was like, let's make a phone call to a polyclinic or something, and then let's get on with that. So I make an appointment with a polyclinic. Why polyclinic is also because I was talking to a friend. I can't remember who was that at before. I was just at that state of mind whereby is my son really different from the rest? So somebody told me that get a referral from KK. If I'm not wrong, I think I called KK first, and then KK was like, if you want a subsidized price, you can just call polyclinic and get a referral letter. The waiting time might be long, but it's fine. So at that point of time, I was like, yeah, let's do like the way that was being proposed. So I called KK. I called the polyclinic. I went to I make an appointment. So I sent him there, and basically the polyclinic is like a referral. So they just write whatever that they observed, and they refer me to KK, the CD unit, which is a child development unit. So and from then on, I would say that our lives sort of like changed because it went to a pretty normal family, I would say, to something that we did not expect. So after we went to KK, and then that's where it all happened, and the diagnosis came in, the assessment came in, and then he was diagnosed with a Autism Spectrum Disorder. So that's how it all started. And then lucky enough that I was in Singapore. I was looking for school because with the diagnosis, we cannot ignore the diagnosis and just let him be. Because of the diagnosis, he was referred to the early intervention program. So a lot of waiting time and stuff like that. In the midst, I was also looking for a preschool for him in Singapore. That's when I enrolled him to a preschool which is called Stanford Preschool, if I'm not wrong, before Maplebear took over where it is right now at Phillip Avenue. So before Maplebear was at that specific 12 Phillip Avenue, it was basically Stanford Preschool or something. I think Miss Lady would remember that. So and then after a couple of months later, Maplebear bought over, and a lot of constructions going on and stuff like that. So basically Julius is a pioneer batch of 12 Phillip Avenue in Maplebear. So I'm glad that he managed to went through that. So at that period of time, it was still very manageable for the teachers that was back there then, because it was only like 6 or 7 students, and the teachers basically had a 1-to-1, or basically the ratio is like 1 to 2 students, and at that point of time we didn't see any thing that is of a major setback for Julius or something like that. So and then it went on. After that, a couple of months when the construction is done, we came back to 12th Avenue, and then Maplebear starts to boom, which is a good thing. So a lot of parents starts to enroll, and then that's where the numbers of students starts to increase. So Julia's classmate is getting more and more, and after a couple of months, I think the parents teachers conference about every 6 months, and about a year later, in fact, teacher Yan Ping at that point of time was like telling me that Julius is very difficult to handle. He is very different, and he can't focus, he can't sit down and everything. So I was like, all right, it's the same. Again, the comment that I received back then, I was like, where went wrong? Because he attended early intervention, and he needs to be in mainstream school because that's how he needs to get integrated. So teacher Yan Ping was telling us about she was very difficult to handle, and he doesn't likes to sit down and stuff like that. So I think the last straw is when we decided to Miss Lydia was telling us probably I should get a shadow teachers and stuff like that. And then that's where we started to sort of like think what is a better education for Julius. So that was not a couple of years back. That was in fact only last year. So and here I am now. I'm sharing. He is at a, I would say he's a better environment for him right now. Maplebear is great, but for special needs children, they need to have a very smaller ratio of attention, so that is very difficult to find it in a very larger school setting, especially at the mainstream school. So we are glad where he is now, so I'm gonna share a little bit more as I go on later. Alright, so that's Julius, and so exactly what is special needs, and what's the purpose of me sharing these couple of days a session. So previously, actually this a talk, Miss Lydia and myself have been talking about it for quite some time back. So sorry about the aeroplane. So we have talked about it like for I think ever since last year as well, because I've decided to take the course for special needs children's support, so that I want to understand better. Why I wanted to do that is because that when Julius was diagnosed, I had a lot of my solely research from the internet, and as well as people have been telling me things here and there. I just wanted to know about the facts, what special needs are, and how can I help my son. It's as simple as that. So I decided to embark on a course, and I was telling Miss Lydia that I'm taking this course, and then and after that a couple of months, and then we decided that we should do this talk, and then we started to get busy, and here I am now. So special need is basically, as mentioned here, individuals who require assistance for disability. It might be due to medical or mental or psychological that results learning difficulties, physical disability, or emotional and behavioral difficulties. So this is the main rigor of what special need is in Wikipedia, in dictionary, in any forms of dictionary that you can find. But I have my own definition. So my own definitions for special needs is extraordinary, intelligent, resilient, lovable, and strong-willed. So this is what I've realized living with my son for the past 6 years, that this is what he is. Yes, the medical diagnosis is true. Special needs need special attention and everything, but so much to this negativity. I think I need a little bit of positivity to come up from this. So this is what my own definition is, and I'm gonna go with what my definition is. It is right now. So again, it's important to understand what special needs is, and my intention, my objective to have this talk is actually to bring a lot of awareness, not only being aware of what special need is, it's also being able to accept them for who they are. Like I was just mentioning earlier, we're just chatting with Miss Lydia earlier, that being aware is not enough. Being aware is, I know that these kids exist, but I'm not doing anything. So that's what you're aware, because I am aware. But acceptance, it's you are aware and you're accepting for who they are. You know that they exist. You try to give a helping hand to these people who are in need. So that is accepting them to the society, right? So let's say if you see a children that suddenly have a meltdown in the MRT or on the bus, you know that you're aware that this child is different. So what can you do? What next? Lend a helping hand to the parents or to the caregivers that is in need. I think a lot of parents would need that. Instead of telling them, my friend was just telling me that one of a stranger told her that her daughter is very noisy, asked her to keep quiet, and when she tell them that she has a autism, the stranger replied, so this is the kind of empathy that we get from the society. I think that need to be changed. So the type of different special needs that I think most public should be aware of are of these few. There's a lot of special needs category, but it will falls under these different umbrella. So we have the physical disability, sensory impairment, intellectual disability, learning disability, communication disorder, EBD, which stands for emotional behavior disorder, ASD, which is your autism, and ADHD, which is your attention deficit hyperactivity disorder. So I would really go into one by one, so that all of you who are here, you are kind of aware what is the different kind of special needs, and it's easier for you to pick up the telltale signs as well. But I will really brush through pretty fast for this. I will focus more on autism today, and the rest I will skim through. So let's go into physical disability. So physical disability is any condition that interferes with normal functioning of bones, joints, and muscles. So like the if you know the local stars, Zhou Chuing, yes. So he had a physical disorder because of his musculoskeletal disability, right? So this is the type of major categories that you can find in the physical disability. So musculoskeletal disability and neuromuscular disability, which has got to do with all the neurological functions, and it will affect the neurological functions. So it includes such children's or adults with cerebral palsy as well. So sometimes they are born with it, and they will fall under this category. And the characteristic of a physical disability, you can see them quite obvious. Most of them would be sitting on a wheelchair, and they would really need a lot of special care and attention in terms of health as well, and physical movement, and very difficult in performing gross motor skills, and they also are socially delayed because a lack of interactions. So it's pretty much easy to observe. And next one is sensory impairment. So sensory impairment is specifically for people that has visual or hearing problem. So we seldom call them blind or deaf. Visual impairments, it ranges to quite a lot. So they use so you need to go for a test, and you need to see how's your visuals, and it could be a partial sight, or it can be the full blindness. So again, it means that you need to make sure that this is being fully diagnosed, so that it does not interfere with the child education. So this is important because in our society right now, all our kids are literally watching iPads or watching TVs, and they could just take your phone and just, as much as we really love to cut off, but sometimes for our sanity, when they say that, "Mommy, I just want an iPad," so there you go, and then we just, just need to relax at a few couple of moments. But with kids, I've seen a lot of more and more of younger kids are wearing spectacles already. So I think we need to be aware that these visuals need to be maintained as well. So try to keep lesser hours in front of the screens as well, to avoid the visuals getting worsen and worsen. So of course the cause of it, literally, if you are born with it, it could be a vitamin A/D deficiency. It could be really problem with the eye, which we really see a lot of kids nowadays by watching a lot of iPads. And it could be genetic as well, and it could be infectious disease. Julius has sinus. So what happened was that he had sinus in a very early stage, about 3 years old. So he always have blocked nose, and he's not able to breathe properly. And we brought him to the doctor, and the doctor was like, "Oh, he has sinus." So in fact, the sinus would affect his eyesight, and his eyes would be very, very itchy. He can rub all his eyes all day long, and it would get infected, and it can go like swollen, and with like somebody punch him, so that's the infectious disease. So it can cause by various causes as well. So just take note, if the kids eyes is very itchy, it might be the nose problem. If not, then really too much iPad. So need to be careful on that one. Yeah. So, and then we have hearing impairment for here. So hearing impairment also, it goes by decibels as well. So you can really see, you need to go for a proper diagnosis in order for you to get aids, or any devices that, if the deafness is really the auditory of the kids, he can't really hear or she can't really hear. So I have a friend who the son is born with deafness when he was before birth, I would say. So because when the child is born, you wouldn't know, right? Because you would talk to the baby wouldn't say anything. So they only got to realize it later, about a year or so. And then that's where it all started. So they were checking, and he has deafness of both ears, so he need the hearing aid with the surgery one. So I think it is sort of like very lucky as well that the diagnosis was being found in the early stage, so that he gets a lot of help, because early in the beginning stage, when he was about 2-3 years old, he's not able to speak because he can't hear. So parents started to wonder if he has any other disorder, like autistic or anything. But in fact, it's not. It's just because of the deafness, he's not able to hear. That's why he's detached from socially and speech as well, and all the communication disorder. He has to go for a speech therapy, and to get that back, to get the number of years that he lost his communication due to the hearing. But now he's perfectly fine because of the hearing aid. So I would say that it's very lucky right now. The technology that we have, it's very different from what our parents have in the past. So yeah. And the cause, it could be genetic, it could be environmental, and it could cause by accidents as well. So a lot of cause can give you deafness. So just make sure it's careful. Yep. And next will be intellectual disability. So intellectual disability is a very wide range because a lot of disorder can fall under this category as well. So it's a disability characterized by significant limitation both in intellectual functioning and in adaptive behaviors as expressed in conceptual, social, practical adaptive skills. This ability originates before 18. So before 18 years, you would have gotten these symptoms and everything. So you need to go for a proper diagnosis with that. So the characteristic of this, you would have a very poor comprehension, so impact social functioning because it affects the intellectual, and poor performance of across the range of areas, and difficult working in independently. So this kind of intellectual disability, it's something like the most common one will be Down syndrome. And the cause also it also affects, so for example, the type of risk factors, biomedical, social, behavioral, and educational, and the timing of exposure during prenatal, perinatal, and postnatal to all these factors. So right now we are lucky that when we are when we are pregnant, we are able to do the test for Down syndrome. So that's also to preempt the parents that your kids is gonna be different, so you need to make sure that proper support is being given to the child when it's given at birth, because intellectual disability mostly it comes in during birth as well, so you are more prepared on that. Yeah, so the severity of the intellectual disability is also based on the IQ level. I would say autism also part of this umbrella, because the IQ level, some of autistic children, if we are not functioning, some functioning autistic children, it can goes up to 140 of IQ level, but those have a lower IQ level, that means it will affect their intellectual disability as well. So that's why it's every time when a kid turns 6 years old or before primary school for ASD, they would need to do an IQ test. Julius has his IQ test due next year because I defer him 1 year for his primary school. I think it's better for him. So by then he would need to do this IQ test, and in between they need to prep for this IQ test. So the IQ test is not really verbal and non-verbal, so it's fine if they are non-verbal, because there's a lot of non-verbal kind of lessons that the school can give as well. So the IQ test is based on what they can do and what they cannot do, and then they will give the assessment is based on that. So that's how they can the kids will be able to say, we are able to say like where the kids can go. So for example, for Julius, if his IQ level is of above a certain standard, he can go to a normal primary mainstream school. But if his IQ is below below about 70 and below, he can't go even to Pathlight, so he needs to go to other special needs schools. So Pathlight, you need like 70 and above. Yeah, so and learning disability. So learning disability is disorder one or more of the basic psychological processes involved in understanding or in using language, spoken or written. These may manifest itself in an imperfect ability to listen, to think, speak, read, spell, or do mathematical calculation. So this kind of disability, it's much more affect the neurological portion of the brain, and mostly dysgraphia will fall under this. The one that we are more common, and that one that we known of the public or the society, is dyslexia. So the dyslexia is reading disorder. So when they see proper word, some of the words may jumble up, some of the alphabets may jumble up, so they are not able to process that neurologically. Dysgraphia is actually writing disorder. So some kids would say, so especially for parents 6-year-old or 7-year-old, if your kids is going to primary school next year, this is a good time for you to really take a look at your kids writing. If they are not writing in a line, where you even have given like a line notebooks, then something is not right there. So dysgraphia children or even adults, they can write, and then they can start with a straight line and then they will go down, or the words can just jumble up because the visions are not getting that from the neurological effect. And dyscalculia is mathematic disorder. So for example, you can you give a 1 plus 1, they can't add up to 1 plus 1 equals to 2, and this is the time where you need to think about maybe there's a little bit more than just careless mistake. And it needs to happen often lah. I mean, if you have 10 questions about very simple mathematics, and then he or she just get one wrong, then of course you cannot just say he has dyscalculia. So you need to have, let's say, out of 10 questions he got like 8 wrong, even though it's like super simple. So then something is not right somewhere. Yeah. And then visual processing disorder also comes under this, and auditory processing disorder. So, and the causes of these, basically a lot of dyslexic children, they are really genetic and mostly are premature at birth as well. And as what mentioned here, exposure during pregnancy to nicotine, drugs, alcohol, and infection, that will affect the brain development in the fetus. So I know that when I was pregnant, I remember my friend was telling me that it's okay, you can just drink a glass of wine or something. And then, my parents, being the traditional ones, said, no, you cannot do that. They don't really know what is the reason. I don't really know what is the reason, but after taking this course, I now understand that there are actually a scientific reason behind that. It's not just about alcohol, but what will the effect will be. So again, like if we take a lot of medications like Panadols and stuff like that, Panadol is fine. I remember that when I was breastfeeding, doctor was like, paracetamol is fine even when I was pregnant, but too much of it is not good as well. Yeah. So that is the learning disability. So communication disorder. So communication disorder, also quite a lot of disorder will come under this umbrella. So there's two separate kind of communication disorder that is being categorized under this. Okay, so the main definition, which is affects the individual's ability to comprehend, to detect and apply language and speech, to engage in discourse effectively with others. So I'm not able to speak to people, or there's no communication at all, or communication is considered delayed. So GDD, perhaps, when the child is noticeably behind his or peers in acquisition of speech and or language skills. So some kids in junior school, which is the early intervention, they don't have autism, they just have GDD, which is global developmental delay. So meaning at the age of 3, how polyclinic always have that tick box when we go to polyclinics, and then they will tell us, your kids can do this, your kids can say 3 words, your kids can say 2 words. So they did not check all these boxes, and then they are being categorized under the GDD. So that's where the communication disorder starts to come in. And there are 2 specific category. So one of it, which is speech disorder, and the other one is language disorder. So the cause of this is probably the hearing loss, like what I mentioned earlier on, when my friend's son was he can't hear, so that's why he can't speak, so he can communicate, so that's hearing loss. And also probably intellectual disability also will have communication disorder, because intellectually they are not able to communicate that out. And prematurity, auditory processing disorder. So communication disorder is basically a disorder which a lot of a disorder will fall under. So a lot of the disorder will have a communication skills disability as well. Yeah. Speech disorder. The difference between speech and language. So speech is difficulty in producing speech sound or voice quality, and probably like stuttering, so when they in a sentence they can't speak clearly, so they start to stutter, I, so something like that. So that is speech. They know how to communicate, but they are not able to say it out properly in the sentence. So articulation, phonological disorder, these also come under speech disorder. So as a listener, we may have difficulty understanding. So Julia's sister now also in Maplebear, and in her early years, well, she's only 3 plus this year, but a couple of years back when she started to learn how to speak, she has a lot of problem because her brother is autistic, right? So there's not a lot of interaction. So Celine, which is my daughter, so Celine is slower in her speech because there's no communication going on. Even though we as adults speak to her, she's slower catching that up. That's why I was afraid that Celine might have autistic as well. Miss Celia was like, no, don't think about it that way. Yeah, I shouldn't think too much, but sometimes as a parent, you do think too much. So that is speech disorder. And language disorder. Language disorder is slightly different. So it's impairment in the ability to understand or use words in context, both verbally or non-verbally, improper use of words and their meaning. So it's very important the kids to learn their preposition, in, on, under, and stuff like that, because if they don't know how to communicate that properly, people might think that they have language disorder as well. Inability to express ideas and grammatical patterns and reduce vocabulary, and inability to follow directions. So left and right and stuff like that. So when you say turn to the left, and he might turn to the, I don't know, turn to the other direction and stuff like that. So I think it's something that parents could really pick up if you really spend a lot of time and you feel that it happened often, then something is not right. Okay, I've gone through the course earlier on. Okay, so we are here at the major and the last one. Emotional behavior disorder is you don't really find that in preschool children, but I think it is good for parents to know, especially when your kids are going to go to primary school already, because a emotional behavior disorder is actually such as your depression, your schizophrenia, and the thinking of those nonsensical stuff in their mind. A lot of kids are getting more and more depressed or stressed easily right now. That is fall under the emotional behavior disorder. So inability to build or maintain satisfactory interpersonal relationship with peers and their teachers. They're always by themselves. Something is not right. But some kids also, they might be happy on the outside, but actually they are very suffocated in the inside. So parents need to take note as well, especially when you have kids, they are always confined to their own bedrooms, and then they started to to do things their own. They doesn't want to come up for dinner together, doesn't want to lunch together. Everything is always on their own. That need to take note. So inappropriate types of behaviors and feelings under normal circumstances. So a little bit of characteristic will be externalizing behavior. So one end extreme and the other end to the extreme. So externalizing behavior. So some people will have like aggression, try to rule break, try to do like very non-compliant with parents, with teachers. So these might be one of the symptoms as well. On the extreme side will be internalizing behavior, the one that I was saying earlier on. Social withdrawal, don't like to hang out with friends, anxiety and depression. So these are the common ones that we normally will see, and normally are the one that are detected later in stage because they don't speak out. Okay, so the externalizing behavior are the one that is more simpler to be detected. That's why we have boys home and girls home. So this can be, I wouldn't say easier, but this can be because of the early detection, so they are able to be sort of like mold them into a better person, I would say, or sort of like have their disorder being diagnosed and get a proper help and treatment. But the one that likes to internalize their behavior is the one that is very difficult for us to really get them out and talk about everything, right? So Yeah, and distorted thinking, immaturity, and then we have this extreme behavior of bullying, fighting, and stealing. So these are insecurities as well. Okay, so something for you to take note on that one. All right, so now yeah, I sort of like gone through the basic understanding of what special needs types that people need to know. So ASD and ADHD, because I'm doing that on a different context, so I won't be talking about here in this area. So autism spectrum disorder, I'm gonna go slightly more detailed in this because it's something that it can be detected very early, especially when preschool teachers or parents can sort of like read the telltale sign and you're able to detect them. All right, so autism spectrum disorder, what the normally the stereotyped kind of definition that people know is just autistic. They don't really call it as ASD, or they don't call it autism spectrum disorder, so it's just autistic or autism. Back in the days, Asperger's syndrome was a separate disorder from autism spectrum disorder. So Asperger's syndrome is a disorder by itself, autistic is a disorder by itself, but it was combined together. So now under ASD, we have autistic disorder, we have PDD, NOS, which is pervasive developmental disorder, not otherwise specified. So that means they did not tick all the criteria of autistic disorder, but they only have a certain criteria that are being ticked, so that it also falls under that. And Asperger's syndrome. All right, so what exactly is autism spectrum disorder? So it's actually a neurological conditions at birth. It's not something that it only developed after birth, so it has already, the kid would have gotten it while at birth already. So mostly will be deficits in social communications and social interests, stereotyped motor and verbal behavior, unusual sensory behavior, meaning they are very scared to, let's say, hearing. When the aeroplane is flying, they will just cover their ears. When you're vacuuming, they will cover their ears. They really hate the thunders. Julius hate the thunders. So very sensitive into to their sensory, don't like being touched on the skin. They would just jump off, they would just melt down, and excessive adherence to routines and ritual behavior. So they like to follow a very routine kind of daily activities. So if there is break, they would suddenly melt down. You wouldn't know the reason, right? So, and then restricted and fixated interests. So Julius loves cars, anything with transport. Now he's into maps. So when he is engaged into one item, or let's say into one category of item, they will hold on to it for a very, very, very long time. So you wouldn't even think about changing them or changing their mindset. You can't. They are very fixated in that. All right, so the cause, I would really love to share this because this is a very good graphic itself. So these things don't make people autistic. So this is very funny. It says that parents who act like refrigerators, so meaning you can just take out anything, and harmful kind of food. So sometimes as parents, we would think that what did I eat, that caused my kids to do this. And vaccines, I've been reading a lot of articles that MMR vaccines could cause autistic, but again, it's not scientifically proven, so it's not so toxic and stuff like that. So the real cause of autism is a living couple. This is very true, in fact. So a living couple that has a baby born with a special kind of brain. So remember, autistic kids are born, not made. They are born, they are not made. It has always been this way, and there's no epidemic. This is very, very true, and I agree with this sentence. Autistic kids come from love, not poison. Autism is as natural as blue eyes or curly hair. Autistic kids become autistic adults. Autism is for rarer. Welcome it, support it, don't try to cure it. I am in love with this diagram because autism is not a disease. Autism cannot recover. When you're born with it, you're born with it. Whether you're 5, 2, 10, 15, 18, or 50 or 70s, you will have an autism, or the autism, it will always forever with you. Some people will say that I think the kid outgrown. You can't outgrow autism. You only find ways to manage your meltdown find ways to manage your emotions, your behavior. So that's why early intervention is important, is to teach them how to be control of themselves, how to find a sanctuary for themselves. So this is why early intervention is important for them as well. So early detection is super important. Yeah, so and we have the triad impairment. So the triad impairment will impairment of autism will fall through under these three category. So language, communication, behavior, and social interaction. Any kids that has ASD will have these three major problems. So we need to make sure that teach them properly, embrace them, and to let them know that there are people who support them. Yeah, so these details, let me just share. This is very important as well. Yeah, so social interactions, communications, activities, and interests. So this is the early detection if you want to pick up the telltale sign. There is no eye contact. They appears unresponsive. Okay, does not make friends with their peers. Do not have any special interaction with people. Some kids, they don't call mommy or daddy even until they are at the later age, whereby 6 or 7. So unusual and repetitive language, they like to see things that are in repetitive motions. And then some high functioning one, they would be skilled to do some things that are more difficult in tasks, but then again they also have that social deficit in that behavior as well. So and then you have in the communication, they cannot initiate or sustain a communication or conversation. So you can ask one sentence, the reply is either yes or no. Sometimes they don't even reply you. Okay, and then you will have a very rigid routine, fascinated with certain parts of object. So for example, some children, they are very fascinated with doorknobs. They will just keep playing the knobs, and which is fine. You just need to make sure that you find a proper method how to control that, how to talk with them, how to make sure that try to, I wouldn't say try to break the repeated patterns, but I would say go into their world and bring them out. So that is my motto every time when I'm engaging with Julius, to go into their world and bring them out, instead of without going into their world and then I start to stop them to do whatever that they're doing, or straight away like take away their things and stuff. They will just melt down and having a tantrum. Yeah, so with that, I have the last one for today. So what's next? If you suspect or teachers suspect that your kids is have a indifferent from the rest of the kids, please do not ignore. Always have a communication with parents and teachers, vice versa. Update each other. If they are lack in their social or in their language, in their academic, I wouldn't be too worried about academic at this point of time, but I would be worried about social behaviors and interactions, if there's no eye contact, and if you're talking to a kids and there's no response. So these are the things, the red flag that I would look out for. So academic, I think is still fine. So if the kids still don't know what is 1 + 1 by the age of 4 or 5, that can be taught. But social behavior interaction, it needs more engagement. So it needs a proper help and proper method of engaging. So that is very important. I would say try to get a proper diagnosis. So I mentioned earlier on when I was talking about Julius, how we get a proper diagnosis, and we need to hit for medical professionals help. If you don't mind not having a subsidized one, you can straight away go to a private clinic, therapist clinic, and get a diagnosis. The diagnosis is not very cheap, so that's why I've chosen KKH, because it's subsidized. And then having a special kids, we need to spend a lot of money in a lot of different assistive support as well. And the toys that we need to get is very special. It's not a basic toys. It's something that has to trigger his neurological functions in terms of thinking, talking, communicating. So save the money on that. And so get a referral from the polyclinic. And next, I would really suggest and advise to go for early intervention. Two types of intervention in Singapore. Either the subsidized one, which is the early intervention program, and the enhanced PIPP, which is a pilot for private intervention. So meaning they are a standalone private clinics and therapy center, which you also can go. SJ Enable, you can go to the website to know more and understand more about what support they are available in Singapore for ASD as well. And last one but not least is really to embrace and adapt, not to change. I wouldn't say change them, I would say to embrace them and adapt to them, and go into their world and take a look at how is it will be. So I think with that I would end today's session. It's a pretty long session. So if you wish to know more in details, you could just contact me, and then I can talk